Mm.
So speaking of the patients, what type of training was involved in this? And I know you talked a little bit about what to do if there's maybe not the right amount of steroid being used, but what did the training look like? And I'm also interested in the overall age and demographics of your patients, just to kind of understand how they took to using the insulin pump in this way.
Yeah. So ideally, you have a diabetes educator that's affiliated with your clinic, and they're sort of the ideal person, I think. And in the clinic, when we meet with the people, we will kind of go over. Are you sure you want to make this transition? Here's what it encompasses. And if they're pretty eager to proceed, then we'll have them meet with our diabetes educator. And generally by then, the patients have a good idea about what kind of insulin pump they want to pursue, but not always. But our educators will have several of the different commercially available pumps in their clinic. The patients can review those and kind of see what's most in line with their daily routine. And then they basically go through it, right? And so at that point, they'll kind of go over how do you fill the reservoir with the hydrocortisone liquid solution? How do you make adjustments to the basal settings? How are you delivering these at least two boluses that you'll do over the course of the day? And they'll also go over kind of troubleshooting issues because sometimes people will develop adhesive sensitivity. What sort of tricks can you do to kind of make things more manageable for the patients moving forward? And so we have a very good relationship with our diabetes educator who has really helped to kind of start over 30 of these people with adrenal insufficiency on the pumps.
Mm.
When you asked about some of the demographics, so the average age in our cohort was 43 years of age. The majority, about 80% of our people with adrenal insufficiency that we used pumps with were women, and whites, non-Hispanic, in almost all cases there.
Interesting.
Mm.
How was this in terms of cost effectiveness? Did you see any benefits? I think that I know the answer is probably yes, because things are being used more efficiently. But what did that look like on your end?
Yeah. So I think, when a lot of people think about switching over from the oral hydrocortisone to an insulin pump, they think, well, obviously this is going to be more costly kind of in the short term using this, durable medical device, having to kind of change out these infusion sets, using the liquid hydrocortisone compared to the oral. And yes, in the short term, absolutely, there's going to be an increase in price, buying the pump and kind of getting all these other supplies. But, moving forward, there's likely some other factors there that I think will be cost savings in the long run. Fewer days in the hospital, fewer times presenting to the ED, for example. That's a big one. But I think the biggest thing is really in terms of kind of getting people back their quality of life, right? So now we're seeing people that, previously were, if in their words, kind of stuck at home, really unable to kind of engage with the outside world. Now, many are fully employed. They're spending time with family, kind of doing other kind of rewarding activities, able to go to school, kind of getting higher level degrees, et cetera. And so I think that in the long term, if you have someone that's really kind of get back that sense of life, things that they couldn't do before, and also spending less time in the hospital and the ED, I think the cost savings are going to be shown, but that wasn't kind of a part of the analysis that we've looked at, unfortunately.